How are you all going to sit up there without the visual aids?
In the United States, we continue to have new cases. As of this morning, there were 712, I believe, with 27 deaths. Guaranteed by the time of this evening, that's going to be up, and there'll be several more. And tomorrow, there'll be several more. So we realize that this is something, obviously, that we've been saying all along, that we're taking very seriously. Now the question is, what are we going to do about that? And there are a number of things that one can do in order to blunt it. If you look at the curves of outbreaks, they go big peaks and they come down. What we need to do is flatten that down. That would have less people infected. That would ultimately have less deaths. You do that by trying to interfere with the natural flow of the outbreak. So what we're saying today is that although we keep coming in and saying appropriately that as a nation, the risk is relatively low, there are parts of the country right now that are having community spread in which the risk there is clearly a bit more than that. And you know the places, Washington State, California, New York, and Florida. Establishment safe. This should be universal for the country. Everyone should be doing that, whether you live in a zone that as a nation, we can't be doing the kinds of things we were doing a few months ago, that it doesn't matter if you're in a state that has no cases or one case. You have to start taking seriously what you can do now, that if and when the infections will come, and they will come, sorry to say, sad to say, they will. But when you're dealing with an infectious disease, we always have that metaphor that people talk about, that Wayne Gretzky, he doesn't go where the puck is, he's going where the puck is going to be. Well, we want to be where the infection is going to be, as well as where it is.
And we're very fortunate between Dr. Fauci and I. We have long-term contact.
If you are immunocompromised, if you have chronic medical conditions, if you are over the age of 60, you are at higher risk. If you are a child or a young adult, you are less likely to be impacted by the coronavirus.
As we said, we can't say often enough, the risks of contracting the coronavirus.
Are you in an environment where you can telework? Are you planning on going to large gatherings like church? Do you live in a community that is being particularly impacted by the coronavirus? And you can find out this information from your state or local health department. Does your state have a hotline that you can call into to help you assess symptoms?
To the average American remains low, but for senior citizens with serious underlying...
And we have really leaned into coronavirus.gov. Please send people to that website. We've put the tools on there for individual groups, specific audiences, so that people can understand how to stay safe. If we follow this prescription, we will overcome the coronavirus. As Dr. Fauci said, we will see more cases. Unfortunately, we are likely to see more deaths. We have not hit the peak of this epidemic quite yet, but if we follow this prescription, then we will decrease the number of people who are impacted, we will decrease the number of people who will die, and we will more quickly get to the end of this situation.
When is the general public going to see what you all have put together?
Right. Larry? I'm very confident that the campaign will take the very best information and make the very best decision going forward. But these proposals are things that every American can do all across the country that will reduce the risk of either contracting or being exposed to the coronavirus.
That would be a 12.4% reduction. Back in 2010, we had a 2% reduction. Can you basically eliminate, for however